The views expressed on this video are that of Gunnar Esiason and guests, and not necessarily those of the Esiason Foundation. Nothing in this video should be considered medical advice.
Hey, it's Gunnar Esiason here for another cystic fibrosis step-by-step video. All right, so in this episode we have some common cystic fibrosis vocabulary. There are over 1,000 cystic fibrosis mutations that exist. It's a little overwhelming, so if you didn't pay attention in biology class, we'll give you a quick rundown right here. The CFTR mutation, the cystic fibrosis transregulator mutation, or membrane, is what basically determines if a person has cystic fibrosis or not. There are different classifications of mutations. You should talk to your doctor to see which mutations your son or daughter may have and how those mutations may end up manifesting the disease. The measurement of your vitals is going to be one of the first things that happens when you get to a CF clinic. They're going to look at your oxygen saturation, which is the amount of oxygen in your blood pressure, your temperature, and then the doctor will obviously listen to your chest. We have the vest. The vest is a machine that basically shakes the patient to loosen the mucus so that we can cough it up. Here in the US, the vest is one of the more popular devices for airway clearance. The frequencer is more of a targeted therapy as far as airway clearance goes. It's a handheld device that uses sound waves to knock mucus loose in the lungs. There's also PEP devices like the acapella and the flutter, which basically use breathing exercises and breathing techniques to move mucus. Home care is the term that we use when people are on home IV antibiotics. They basically take their PICC line home or their port home and are using intravenous medications under the oversight of a home care nurse and a home care company.
The views expressed on the cystic fibrosis step-by-step with Gunnar Esiason videos are that of Gunnar Esiason and guests, and not necessarily those of the Esiason Foundation. Nothing in the cystic fibrosis step-by-step with Gunnar Esiason videos should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Esiason Foundation, Gunnar Esiason and guests cannot be held responsible for any damage which may result from using the information on this video without the permission of your medical doctor. Thank you for watching Cystic Fibrosis Step-by-Step with Gunnar Esiason, presented by the Esiason Foundation and GunnarEsiason.com.